welcome everyone. Welcome to the Advocacy during COVID-19, having our voices heard. I hope that you are all well, and I'm so happy that you were able to join us. Next slide, please. It is my pleasure to welcome our panelists today, starting with Cesar Garrido, our newly elected WFH board member, board president. And myself, I'm Dawn Rotellini. I'm a board member of WFH and also the Chief Operating Officer of the National Hemophilia Foundation in the United States. We have Julie O'Donnell, who is joining us from EVO Kyne, Alexsandro dos Santos Machado, who is a professor and a member of the Brazilian Federation of Hemophilia, Dr. Munira Borhany, hematologist and head of Hemophilia Society Karachi in Pakistan, and James Kago, who is a board member of the Kenya Hemophilia Association. Welcome, everyone. Next slide, please. So our agenda today, we'll have the welcome from our newly elected president. We'll talk about advocacy during COVID-19. We'll discuss and hear about building a strong online advocacy community. And then our panel of NMO speakers come from Brazil, Pakistan, and Kenya. We'll have a chance to use Q&A. And so you'll start to look for the Q&A button on your screen, and then we'll have a conclusion. Next slide, please. So for those of you who are using a computer or a tablet, for questions and translation, you'll see the Q&A button on the bottom, and also an interpretation, that little global sign is also on the bottom. You can select your language preference now. So I'll give you just a second to find that. And you'll submit your questions in the Q&A box. We have translators in 5 languages, so they will help to translate those questions as well. Next slide, please. For those of you who are using mobile phones, on the left, you'll see is an image of an Android phone, and you'll see that on the bottom, it's still, you've got the Q&A, and those 3 dots on the very bottom right, that's how you'll select your interpretation channel. And then for this, the picture in the middle, that's an iPhone. A little tricky thing with the iPhone is you'll select language interpretation. And then on the far right snapshot, you can see you must, once you select your language, you'll click on done. If you don't select done, it doesn't actually select your choice. So take a moment to do that now, please. Next slide, please. I'm so happy to let you know that this webinar is being recorded, and you will be able to access this and share with your community members later on the e-learning.wfh.org platform. And a recording will be available shortly after this session. Next slide, please. I just want to point out that we will not be addressing medical questions today. This is strictly an advocacy webinar. I know sometimes when we come to these meetings, a question pops up, but it's a medical nature. It might be about COVID, it might be about hemophilia. But today we are really talking about advocacy. However, you can find on the e-learning platform many of these topics that you may have questions about, such as COVID, psychosocial perspectives, bleeding disorders in COVID, etc. So please go there for those medical questions. Next slide, please. So a huge thank you to our sponsor today. We'd like to thank Hemophilia of Georgia for their support of this webinar. Hemophilia of Georgia has partnered with the World Federation of Hemophilia for many years, supporting the WFH Humanitarian Aid Program, Youth Leadership Program, as well as various training and educational programs, such as the Cornerstone Initiative and the upcoming Women's Summit, which I hope you will all join us for. So our sincere thanks to them for their commitment to the global bleeding disorders community. So it is my pleasure to welcome Cesar Garrido, our WFH president. He's the incoming president. He was born in Caracas, Venezuela. He has 2 sons, one of whom has hemophilia A. He is an entrepreneur, a passionate volunteer for hemophilia and other rare diseases for the last 23 years. He is also my good friend and colleague. Cesar, please take it away.
Thank you, Dal, and good morning, good afternoon, good evening, wherever you are. So friends and colleagues of the hemophilia community in the world. I am very pleased to open this important event since being my first opportunity in public as president of the WFH, it's precisely a topic that, in addition to being passionate about, I believe is the key of this time to be available, to be able to design a path different and with a very good perspective, the advocacy. Advocacy is the formula to convince the decision makers in each of your countries and regions that we want and believe as appropriate, and our goal is for them to see it that way. When that happens, then we have won. Perhaps some of you think that Cesar is saying something that is not possible to put into practice in these times of pandemic and quarantine thanks to COVID-19. But the reality is that if we see the positive side, it's giving us the opportunity to study, train ourselves, learn more about topics and strategies that will be useful to us when we go out trying to convince the decision maker by doing effective advocacy. Keep in mind that everything in our lives has changed since March of this year, and the real scenario have made the health system review and change. So we cannot continue doing after this nightmare called COVID-19. Always keep in mind, one day the COVID pandemic will be over, but hemophilia will be there and will continue to be our main goal. The WFH is pleased to making this effort and there to assure the importance of the topic, and the number of registered attendees will do more. So I invite you to invest these 90 minutes listening and learning from these wonderful speakers. Thank you, and thank you for your attention. Enjoy this webinar.
Thank you so much, Cesar. Wonderful welcome from you. It's so great to see you in this position, and the fact that this is your very first time addressing the world. So thank you so much. Next is me. I'm going to be sharing about advocacy during COVID-19. Next slide, please. We are so excited that this is a global webinar. This is for the entire world. There will be follow-up with regional webinars to come, so stay tuned for your region as well. So our agenda during the next part is, I'm just going to share a little bit about the WFH vision. And we'll also discuss obviously the COVID-19 pandemic and the bleeding disorders community. I agree with Cesar. This is a time for learning and for us to be able to keep our community strong. And we'll talk about advocacy during COVID-19 that will help us do that. Next slide, please. So I know you have all seen this, but it always helps us to remember our vision is treatment for all. It should not matter where you live in the world. You deserve safe, effective treatment products that should be available for all people with inherited bleeding disorders. That's hemophilia, von Willebrand disease, men, women. We need proper diagnosis and management. We need care by a multidisciplinary team of trained specialists. Expanding our services beyond hemophilia to von Willebrand disease, rare factor deficiencies, inherited platelet disorders, and this year with the first summit for women and bleeding disorders. Very excited about that. Next slide, please. So the impact of the pandemic. We know that COVID-19 has hugely impacted all countries' healthcare systems. And this crisis really will remind us to go back to the basics. When I say back to the basics, it's about data. We have to remember to share our data, to collect our data, and to be able to tell our stories to government and healthcare officials. We need to protect our standard of care and ensure equity in health. So it goes back to the basics. Gather your data, start writing your stories again, reach out to decision makers, and remember there is less money for rare diseases because more and more finances are going to infectious disease management like COVID-19. We can expect cuts in healthcare budgets. So think about how would you manage a 30% decrease in hemophilia care in your country? This could be devastating. So we have to advocate and tell our story. We must ask for maintained funding for services and resources and treatment. We must protect that standard of care that we have fought so hard to strengthen and maintain. And if you don't have a standard of care in your country, we must band together to help each other get to that place. Next slide, please. So WFH's response to the COVID-19 pandemic has been a lot of education on COVID-19 and bleeding disorders through WFH statements and webinars. They have strengthened the virtual training and education. This is an example today. We also conducted an NMO survey on COVID-19 pandemic and the bleeding disorders community and what you are worried about and concerned with. We have offered financial support to NMOs for internet connectivity, software and equipment for online training and other projects. We have the development grant program, which we just saw tremendous growth in the kinds of grants that we're receiving have been really very impressive. And we have a COVID-19 relief fund. And then finally, strengthening our advocacy geared activities. So a little note about the survey. I'm sure you're wondering what was said by all of the NMOs. 100 NMOs participated in the WFH survey. And we're analyzing the results now, and we will publish all of them. But here are some preliminary findings that I can share. Healthcare systems around the world are overwhelmed with dealing with the pandemic, and it has created a certain shortage of healthcare professionals. And human resources are being directed to fight COVID as a priority. We are seeing this throughout the world. In addition, the same is with hospitals. In some cases, hospitals have actually reorganized to serve COVID only or partially. So taking away our beloved doctors and nurses to be able to help with the pandemic has happened in many places. And this brings us to a necessity for better education of patients to become more self-reliant in taking care of ourselves. And I'm sure, and it's not listed here, but I bet that telemedicine is also part of that, making sure we're still following up if we have options for telemedicine. But we also have to learn to self-infuse. We have to learn to exercise. We have to learn to take better care of ourselves. Another finding, the worsened socioeconomic condition has affected widely our community's active participation in receiving care and treatment. And this is due to given priority, of course, to earning for a living, absence of financial means to take care of various expenses, for example, transportation, getting to the hemophilia treatment center. The effect on the psychological well-being of patients and their families has really been a takeaway as well. In some cases, it's just blocked their access to being able to maintain the necessary treatment or making it really people be fearful to make the necessary visit to a hospital. They're staying at home instead of going in and taking care of a bleed or some other health condition. So next slide, please. So, the question for today is, what is advocacy? And I know that there are different definitions, but WFH defines advocacy as the process of influencing key individuals or the decision makers. This could be the Minister of Health, the Minister of Finance, or a hospital administrator. And so in this case, we're talking about maintaining, which would be potentially a budget for hemophilia treatment. We really cannot afford to have budget cuts. And so we have to convince our government officials to maintain the budget. Changing, we mean implementing new policies or standards of care that didn't exist before. And then advocacy support of the WFH is aimed at helping NMOs around the world advocate for proper diagnosis, management, and care. And we need safe, effective treatment products. This is what we mean by advocacy. Next slide, please. It is a hurdle to jump. I hear you. So main steps of advocacy campaign. So what do we want? We have to tell them. We can't assume that they know what we need. So we must create goals and objectives. Who can give it to us? Well, sometimes it's the population can support you, but decision makers. What do they need to hear? They need to hear your story. They need to hear your community messages. Who should they hear it from? Us, right? No one's going to do this for us. So we need to be prepared to go tell our stories in person. And how do we get them to hear it? Well, delivery and presentation, of course, but can we do this face-to-face? Maybe not. Maybe we do it by Zoom. Maybe we do it by social media. Always kindly use social media, but maybe that's a way to get their attention. What do we have? We do have resources, and we can help each other get to that place. We collectively are now 147 countries. We can go together and help out. There are countries that do a phenomenal job. I look at Bradley in South Africa, and I heard his presentation. He has a step-by-step process. Everyone can learn from that process. So what do we need to develop? We do need new resources. And that's one of those examples where we can help each other. Take the first step. It can be overwhelming. If you look at an advocacy campaign, it can be overwhelming. You think, I just can't do it. It's too much work. One step at a time. And how do you tell if it's working? We need measurements in place. So it's not easy, but we're here to help each other. Next slide, please. Something to remember is that we need SMART goals and objectives. And SMART means specific, measurable. So remember, we need to say, what does success look like? We have to measure that. It's got to be attainable. One person can't do it alone. So what resources do you need to help you get there? It has to be relevant. What do you actually need to gain care and treatment? You can't go from no treatment to full prophylaxis for the whole country overnight. You need to take step by step by step. We have to work as a team, as Megan just put in the chat, and time bound. Do not think that you're going to accomplish an entire advocacy campaign in 2 months. It might take you 3 years to put it together, but that's why it's important to have a step by step by step. Next slide, please. So our target audience, always we say government officials, always we say the hospital administrator, but my secret person to go to and start building the relationship now is that secondary audience. Who is the assistant to the government official? The government official may change over time because of elections or because they leave their job. Those people that work in the office are usually there for a long time. Get to know them, honor them, tell your story to them as well, because they're the ones that can get you into the door. And understand that at the end of the day, they do have these huge challenges. If they have a budget that has to be reduced because 30% of it goes to COVID, well, what happens? They have to make a decision. If they have $100 to give treatment to 100 patients with diabetes, or they have $100 to spend on one patient for one treatment at one time, and it doesn't impact their whole year, and that's somebody with hemophilia. If you have that challenge of balancing a budget, what do you choose? So we have to help them understand what that impact of the $100 does for us, how that will keep us alive, how that will keep us working. So we have to identify all of our key players early. We have to do our research, and we have to think about what's their perspective. They don't want us to be sick. That's not their goal. They're a healthcare administrator. but we have to help them make good decisions to keep us healthy. Next slide, please. So here are some opportunities. There have been huge changes due to COVID. In some places, we've for the first time gotten home treatment and care. We've had home delivery of treatment products. We have home infusion support or telemedicine. So out of this list, what do we want to keep? What do we want to go back to the way it was? I mean, nothing beats a face-to-face visit to really assess our healthcare needs. But overall, I can have a televisit and be able to get what I need and that support about, do I need to infuse? How much do I need to infuse? What's the bleed I'm having right now? So we need to be able to think about what we want to keep that's new and what we have to go back to. Next slide, please. So remember, be concise and persuasive with your statements and your images. Look at this one image that's right here on the screen. On the left, he has a bleeding disorder. We often use those images to really make an impact. On the right, he also has a bleeding disorder. This is an example of what treatment can make for one person. That's your $100 story. The left is without the $100. The right is what $100 could do. So 75% of people with a bleeding disorders do not get adequate treatment. This picture tells that story. So then that's the why. So now, how do you propose to achieve the positive result? That's your step. Next slide, please. We can tell our stories, but data proves what we are saying. If your NMO was not collecting data, it is absolutely crucial that you start today. Ask, reach out. A lot of our NMOs are collecting data. Find out how they started. You can see this. No diagnosis equals no treatment. So we have to collect our data. WFH existing resources are the Global Survey and the WBDR. Use those, they're free. You can access that, and this will help tell our stories. Next slide, please. So messengers, again, we talked about this. Person with a bleeding disorder shares their story. You as a parent can share your child's story. Doctors and other healthcare professionals, sometimes it's great to have a patient or a parent and that doctor to help support the patient's story, and a government official. Next slide, please. Remember, it's all about tone, leaning in, a smile on your face. It's better to suggest solutions than to complain. If you complain to them, they feel like they failed you. No one wants to feel that way. Then they just want to get you out of their office. So come in with friendly support. Thank them for being there. Thank them for listening to you. And then give them the stories and the data. Next slide, please. You can do this in person, as we know, but you can do this in a virtual meeting. You can use Zoom. You can also invite them when we get back to doing things face-to-face, which I pray we'll be able to do that soon. Invite them to your special events. Talk to them on social media. Share on social media. You can also do petitions and letters and public demonstrations, but always be respectful. Next slide, please. Yeah, thank you. So the resources that you need financial, obviously, but you can do that with a little bit of fundraising. It's really the human capital. It's the time spent. It's your volunteers. You definitely need information. WFH can help you with that. Other NMOs can help you with that, and time. When you figure out what your advocacy project is, write these things down. Don't just assume that you'll get them when it comes to it. Write it down in advance. Next slide, please. This is probably the most critical piece that you can use for advocacy, and that is the updated Management of Hemophilia guidelines. This matters. This holds the data and the story about what is necessary to live a healthy and successful life with hemophilia. We need to prove to our decision makers that it can be done. This updated management of hemophilia is a key advocacy tool. Next slide. And by the way, you can find that advocacy tool, the updated guidelines, on the WFH website. So first steps, consider a strategy and a plan that fits your issue. You can't solve 50 issues overnight. Pick one. Figure out what is your most important thing that you need to do and then focus on that. Timing is important. Design a realistic plan. Like I said, it's step by step. And then form a committee. One person can't do this alone, so form a committee. Next slide, please. Evaluate what was achieved, what worked well, what you need to change, what difficulties or problems did you encounter, and then what's next. So just do this step by step for each and every one of your goals that you have. Next step, please. And finally, remember, there are hundreds of educational resources, articles, booklets, handouts, binders, videos. It's an amazing thing, and they're in multiple languages, and this is all free of charge. This is all on the elearning.wfh.org. Sometimes it can be overwhelming also when you have so many resources. Reach out to one of us and say, what do I need to take this first step? We've been there. We're here to help you through it. Next slide, please. And with that, it is my pleasure to say thank you. I know it's a lot of information, but I'm super excited to go on to our next panelist. So we have a video, Building a Strong Online Advocacy Community, from Julie O'Donnell. Julie is a proven digital and marketing strategist with more than a decade of experience. She has led high-performing communications, digital marketing, design, and development teams in marketing and communication agencies. At EVO Kyne, Julie leads the global team focusing on digital strategic planning, advanced data and analytics, influencer marketing, web and social content of strategy and community management. Roll the video.
Hello, everyone. My name is Julie O'Donnell. I'm the Global Head of Digital at EVO Kyne. EVO Kyne is a healthcare specialist agency focused on healthcare communications and proudly has worked quite a lot in the bleeding disorders community. So I'm really excited to talk to you today. In today's session, I'm going to focus on two things. Firstly, we're going to look at what is online engagement today? What channels matter most for you to reach your audience? And then what are some of the principles for success? Tips, tricks, do's, don'ts, to really make sure that you can have the best possible impact online. But first, let's take a moment to think about what modern advocacy is today and what is the role of social media and digital communications. Today, the internet touches so many aspects of our lives. The internet has become our water cooler, our meeting point, the community center, the notice board, the comment box, our news feed, our newspaper. It's touching so many things. In pandemic times, the digital experience is the only experience that so many people have with your organizations. So it's really important, more so than ever, that we really make sure our digital strategies are optimized for success. And when it comes to health advocacy, social media offers such opportunities. It allows us to remove barriers that might have traditionally impeded access to information and support resources. We can now reach people at a scale, cost effectively, that we could never do before, and engage, inspire, and empower them so that we can build a network of advocates who are really engaged in advocating for optimal care for themselves and for their loved ones. And importantly, when we think about some of the rare conditions that are impacting your communities, social media allows us to reach these niche communities in a very focused and targeted way. So you can reach the right people with the right content at the right time. So when it comes to success online, there are 3 elements that really drive a model for success: awareness, engagement, and action. These 3 things must be part of your social media strategy for you to be successful. So awareness, how can you engage supporters, engage key audiences to drive their desire to support your cause? How can you build relationships with key audiences in the digital space and complement things you may be doing offline to really drive that 2-way dialogue? And how can you drive meaningful and lasting action that supports your organization objectives? So taking a look now at social media activity globally, it really is quite staggering. 51% of the world's population are using social media. 89% of people 15 to 64 years old are using social media apps. And the majority of these people, regardless of location, are accessing social media first and foremost on their mobile device. And this is really important to reflect on when you think about the types of content that you're creating. Finally, most people, according to the latest data from Global Web Index, are actually a member of almost 9 different platforms. So as you can see in this visual on the right-hand side, there are overlaps when you look at where users are online. So you have more than one opportunity to reach the same individual if you are active on more than one channel. But unfortunately, you have to be active on more than one channel. So which channels do you choose? Facebook, YouTube, and Instagram are the top 3 platforms all around the world. So for most of you, those are the 3 platforms that you should really be focused on. But depending on your target audiences, you need to be looking really critically at the platforms. For example, if you're looking at a teenager with hemophilia, you should be considering TikTok, which is really rapidly rising with the teenage audience and the under 34s. If you are aiming to engage a woman age 34, you might think about Instagram, you might want to think about Pinterest. A hematologist, you might want to be thinking about Twitter. So there's no one size fits all when it comes to your social media channels. So it's really important to think about, who do you want to reach? Understanding your audience will help you understand what channel is the key one to be spending your time and effort on. So firstly, before you even think about new channels, think about where you're already reaching and engaging people. Fish where the fish are. Think about, can you reach these people through your email lists, through your website, through your existing social media following? And then if not, start to think about other channels, other touch points. A really useful resource is statista.com. It has free data and paid data that allows you to really understand what channels are popular in your country for different age groups, different demographic, gender, etc. So important to take a look at to really understand what's popular in your country, but also evaluate your results to date. Look at your website traffic, look at engagement you might have seen with social media posts to understand where you already seeing success. So as I mentioned, unfortunately, I'm not going to tell you the one thing you should do. There is no silver bullet, but by really understanding your audience and understanding not just who they are, but what their content and information needs are, you can have success online. So each social media platform has its own nuances, its own behaviors and best practices, specifications for images and videos, and all of these things are important to shape your story. But unless you understand what your audience want to hear, not what you want to say, you will fail. So really reflecting on your audience's content needs are important. So what do? You ask. You can run very simple polls, you can run online surveys, Or where you have the opportunity to talk to people in real life, you can ask them what content they'd value from you, what they have seen that's impactful, what are they missing? And that will really help shape your content strategy going forward. So in terms of some principles for success, this quote in the top right of the slide is worth taking a moment to look at. A social media strategy allows you to aim for impact, track your progress, and measure your success. And what this means is you can strive to succeed, but you won't always be successful. So you need to make sure that you understand where you want to get to and that you're setting measurable key performance indicators, benchmarks for your success, to allow you to track your progress as you go. And this is really important when you're thinking about how you might be sharing results with any funders, donors, partners, board members, and your broader organization. So really being clear on what you're aiming to achieve and how you're going to measure your success every step along the way. We've talked about understanding your audience. Here's a very simple template that you'll be able to look at later when you see these slides. It allows you to track what do you know about your community, thinking about the subsets, segments, or personas that you may want to reach, so that when you're creating any particular post, any particular campaign, you're doing it with a particular audience in mind, and that will really help sharpen and focus your content, understanding what makes your audience tick. Creating a content calendar is essential. This is your blueprint to control all your online activity. It maps out key milestones, events, awareness days, press releases, speaking opportunities, anything that you may be doing as an organization that you can leverage to create social media content, and also to map and track your campaigns. And it documents your draft social media posts so that you can plan ahead and make sure that you have the time to create content that will have an impact. And lastly, number 4, creating visual content. Visuals are so important. Video, images, GIFs. People want to see something that'll catch their eye and pull them into your content. So talking a little bit more about what makes engaging content. As with any content for any channel, it needs to be well written and it needs to be trustworthy. But you also need to think about how you can bring value. And value can mean many things depending on your audience. Value can be brightening someone's day with some entertaining content. It can be saving people time by contextualizing a key issue, by summarizing a recent report. It can be giving people quick tips on how to live better with hemophilia. Value means different things, but the main thing is to consider how you can be of service to your audience to make sure they keep coming back to you again and again for your content. We talked already about visuals. If you look at the example on the right here, this is a depression campaign, and they use some very simple animations that catch the eye in your feed, but they also have the effect of telling a little bit of the story, so complementing the text to really immerse you in the topic in a way that you couldn't do with just text alone. Timing matters in all aspects of life, but in social media also. You need to think about what might be the best time of day to share content, to have an impact with your audience, but also how you can make sure your content is timely and relevant, that you're not sharing something that's weeks old and no longer seems like it's on the pulse for your audience. Hashtags are important. They allow you to tag your content, to tap into a conversation, to allow people to search, follow, discover topics of interest to them. Different hashtags are used on different social media channels, and you also have best practices for the use of hashtags. So if you're writing a Twitter post, you should have 2 or 3 hashtags maximum. If you're writing a LinkedIn post, you should have 3 or 4 hashtags maximum. On Facebook, you actually can get away with no hashtags at all. So it's important to understand the differences And a quick Google search for best practices on copywriting for that channel will really help you. Invite interaction. That's so important. I want interaction from you. I want you to share your questions so that we can have a good discussion after this presentation. But equally, if you post something online, you want to invite interaction by asking people to share, to comment, to share their perspective. And then inviting action by really thinking through, do you want them to download, subscribe, retweet, follow? What do you want them to do based on looking at this content? They shouldn't have to guess. You should be guiding them along the way. This example you can see in the middle of the screen here is promoting a panel discussion. And you can see very simply, the author asks any questions for guests, and people are posting in the comments questions that they have. So very simple techniques can have a huge impact. So we've talked a little bit about visual content. What does it mean to create visual content, and what type of visual content works? Firstly, avoid stock photos. They can seem impersonal, overused, staid. Leverage your real relationships where you can. Use real people, but try to look for images that stand out a little bit from the crowd, that just feel more raw, more authentic. Avoid blues and grays that can just fade into the background in your social media feed. Think about contrast, splashes of color that can catch the eye. You want to also have a consistent color palette. So you want to make sure that you're portraying your organization in the best possible way. So using the same fonts, the same primary and secondary colors, the same styles. It really does reflect your overall organization brand, your online reputation. So be consistent in how you're showing up in your visual content. Also, again, coming back to the relationships you have, think about collaborating with key people in your community, with influencers and key opinion leaders, working with them to create or co-create content that will be really relevant and stand out, again, as very authentic to your audience. So canva.com, which you can see highlighted in bold on this slide, is a very simple tool to use. There's a free version, and it allows you to select different types of social media post graphics, templates, where you can change the color, change the text, make it feel like your organization, but at low or no cost. So it's a way to really make your images consistent, but also make sure they're to the right specifications for each social media channel. On the right here, you can see another simple technique where Movember, they're using emojis to draw eye contact, pulling you into the call to actions to learn more and to sign up. And again, they have a video montage of real people participating in the campaign, and that movement and engagement pulls you into their content. Unfortunately, today, you do need to pay at times to stand out from the crowd. Platforms like Facebook, who also own Instagram, have optimized their platform and their business to make money, and they want you to advertise. And what that means is organic reach, the number of people who see your content without any paid promotion, without any ads, is lower, it's falling. So if you are not advertising and you post something organically to your social media channel, it will be seen by less people, and that number is falling. So really think about, for key campaigns, key content, it might be worth your while having budget to make sure that you can amplify that content and get targeted, relevant reach. Some examples of ads, and again, picking Facebook here because it is one of the top channels globally, just to give you some examples of the different types of things people are doing that are impactful. On the left-hand side, you can see this example from Bloomberg. It's a simple technique where they're using a striking color, the pink, to catch the eye. Even on this slide, you can see it stands out from the other two images. Also, very simple call to action to learn more, and asking people, what is coronavirus? Pulling them in so that they're questioning themselves what they know. Very simple copywriting technique. but very effective way of data visualization to grab attention. In the middle here, a very different approach. You can see at a glance, this seems like a very informal image. It could have been taken on your phone, on my phone. It's an image of a real person who's purchased this quilt. So again, tapping into that authentic feel to stand out from content that might seem overproduced, but a very simple message. You know, custom t-shirt quilts at the best price, learn more. At a glance, you understand what this content is about. And people are skimming online. They're not necessarily reading. So you need to be quickly intuitive, but using real people in this way builds trust. And on the right-hand side, an example from a company called Dollar Shave Club. Again, a very different example just to give you a little bit of inspiration. And you can see here they're using a different type of paid ad. So you have this central image and an image carousel underneath. But without reading any of the text, you can see this is about shaving, about razors. So you know at a glance what's on offer. And a very, very simple call to action, pulling people in, curious about Dollar Shave Club, asking that question to invite you to click to learn more. And very, very simple, overall intuitive and really clear. So I will leave you with some very simple tools, free tools that you can take a look at. We've mentioned Canva, which is on display here in this graphic, where you can get template graphics. Hootsuite is a free tool that allows you to post to different social media channels. Simpler and Hashtagify Me are tools to understand your target audience's conversations, what hashtags you can tap into. Google Analytics, free to understand your website traffic. And BuzzSumo, which can allow you to understand what content is driving engagement online. And even as you see here on the slide, what day is the best day to publish? So Friday is the best day to publish hemophilia content. So key takeaways: make sure you understand your audience, understand the channels that are important to them, plan your content in a content calendar, be creative with videos, with GIFs, with images, be consistent in the value that you bring and the frequency with which you bring it. Always have a clear call to action that you can measure and that matters to your organization. And measure, learn, and optimize. Really make sure that you know what's working and that you can continuously improve. Thank you very much, and I look forward to your questions.
Thank you so much, Julie. That was wonderful. And just as a reminder, we'll be using the Q&A feature at the bottom of your screen or even of your phone to type in your questions, and we'll have a Q&A time afterwards. So next, we are, I'm super excited for this. We're going to hear from Professor Alexsandro Machado. He's a psychologist, has a PhD in education and a postdoctoral degree in public health. He's a professor at the Federal Rural University of Pernambuco. Please forgive me for my pronunciation.
It's perfect, Pernambuco.
And a collaborator at startup Aleph for Health, a partner of the Brazilian Federation of Hemophilia. Alex, take it away.
Okay, thank you very much. Well, hello, my name is Alexsandro Machado. It's a great pleasure to be talking to you. I'm representing the Brazilian Federation of Hemophilia. And now I will be doing the presentation titled Advocacy during COVID-19 in Brazil. Information platform of the Hemophilia Care Network. Next slide, please. The Brazilian Federation of Hemophilia has a beautiful history of resilience and care for life. It was founded by a group of family members and caregivers in 1976. Since then, it has advocated the treatment and quality of life of people with hemophilia, von Willebrand, and other hereditary bleeding disorders. Among its main achievements, the universal and free right to domestic treatment and prophylaxis stand out since 2011. Thus, public resources for this type of treatment have tripled. Also noteworthy are the training actions for leaders of affiliate associations and education campaigns. Next slide, please. Brazil has continental proportions with 5 regions, 26 states, and the federal district. There are significant regional differences and social inequality. However, the country has a governmental universal health system that offers free treatment. The FIBH has 25 affiliate associations which follow the same principles and philosophy and represent the 5 regions of Brazil and 2 other associations in the process of formation. Next slide, please. Currently, according to the Ministry of Health of Brazil, approximately 30,000 people receive treatment for hemophilia, von Willebrand disease, and other bleeding disorders. Next slide, please. The current situation of COVID-19 in Brazil is still problematic. We are the 3rd country with the highest number of cases and the 2nd in number of deaths. Although the death curve per day is indecent, a significant drop in numbers has not yet occurred. Next slide, please. But it was exactly in this context of crisis that the Brazilian Federation of Hemophilia intensified its work agenda even more. Several meetings with the federal government and the blood centers were held during this period in order to guarantee available home treatment. Furthermore, it was at this time that we created an innovative alternative to bring treatment and hope to patients with hemophilia, including those in greater difficulty and social isolation. Next slide, please. With this project, FBH intends to become a reference in the creation of technological devices to assist in remote treatment in the self-care of patients and in the dual reference monitoring of clinical process by blood centers. Blood is life in motion. We can learn this from Guarani engineers. Cosmology here. The word blood in the Guarani language is called tugui and means all the energy flows interconnected in the environment in which we live. Next slide, please. Facing the challenges of managing hemophilia in a large country, FBH needs to approach the government with an innovative solution through which we could testify the importance of providing home treatment as well as keeping the patients in contact with the health treatment centers for a better care delivery. Considering that the prophylaxis was already available, the main issue was to guarantee that the treatment centers understood the importance to allow the home treatment and felt confident that they still could monitor the patients even though they weren't going to do HTC with the same frequency. That's why the TUGWI project is so important. Once it provides to the people with hemophilia and the healthcare professional safety and the use of a friendly tool that will keep them connected during the COVID-19 pandemic. Respecting the social distance will guarantee that the care delivery is still working despite the changes of the main HTCs related to the COVID-19 protocols. By training their around 30 healthcare professionals from 3 HTCs and around 30 patients on using Tugui, we were able to optimize the treatment adherence. Based into the Tugui information, we were able to advocate with real-world evidence that the home treatment owns that the Ministry of Health could see the improvement of the treatment products usage and testify the need to keep investing in hemophilia in order to guarantee the patient's well-being. Progressively, our goal is to expand the project to all blood centers, offering Tugui to all patients and to the hemophilia support network. Next slide, please. Tugui aims and self-care of patients so that they can have more adherence to treatment. And now, I would like to request the presentation of a short video of Tugui running, please. Through the application, it's possible to notify a bleeding. To do this, the patient can point to the region of the body where the bleeding occurred. And back to. Yeah. And save it. It is also possible to report bleeding using a photo, for example. Of gallery or the camera. There is a data security policy. Each patient can only access his data. The medical area of blood centers, however, can have access to their patients' data so they can be better monitored. Yeah, I suppose the video. Okay, thank you. Okay. Now, see, yeah, thanks. And audio can also be sent, for example, to notify, or the notification can be done through the keyboard too. You don't need internet to use the app, just to send the data, which are georeferenced in the clouds with total security. The patient can check the set of complications in the agenda. Another feature of the application is its digital infusion diary. Through it, the cell phone converses with the patient, advising him if it's an infusion day, pointing out the name of the medication, form of preparation, method of application, quantity of doses still available, etc. There is also the functionality of an emergency button through which the patient or caregiver can notify and request information from a health professional appointed by the blood center for emergency situations too. Thank you. The next slide, please. Never our world had so much communication at its disposal, and our loneliness has never been so dramatic. There has never been so much road and we have never visited so little. A quote, a writer from Mozambique. May our careful road visit everyone. The next slide, please. Thank you very much for all.
Thank you so much. I was so busy reading the comments in the chat that I got stuck. This is amazing. So thank you so much. One of the I think you really tied technology to advocacy. By using the app, you were able to convince the government to actually provide treatment for patients. So you were able to collect data, you were able to show the story, you were able, I mean, that's just amazing. So thank you very much. And there will be some Q&A later in the session. So next slide, please. So Dr. Munira Borhany from Pakistan is an associate professor and consultant, a hematologist at the National Institute of Blood Disease and Hemophilia Welfare Society in Karachi, Pakistan. She has a special interest in hemostasis and thrombosis and has worked at Angelo Bianchi Bonomi Hemophilia and Thrombosis Center in the University of Milan, Italy during her ISTH fellowship with Professor Flora Pevandi. Dr. Munira, please take it away.
Thank you very much for your kind introduction. It's my pleasure to join this webinar. And today the presentation agenda is the introduction, the background, the efforts of our society. It's a Karachi chapter of Hemophilia Foundation Pakistan, and the advocacy with the government and the challenges we are facing in Pakistan. Next, please. So to give you some background of Karachi, Karachi is the largest cosmopolitan city of Pakistan. It has a population of 20 million out of Pakistan's total population of 220 million. Health is a provincial government responsibility, yet there is no government support to treat or to diagnose the bleeding disorder patients or the hemophilia. Pakistan is not a welfare state, and there is currently no free health structure available to treat these bleeding disorder patients, similarly for the blood disorders. So we can say that there is a weak infrastructure present in Pakistan and in Karachi as well. Next, please. So with this background, the Hemophilia Welfare Society Karachi chapter was established in 1995, but was properly re-established and registered with the Sindh government in 2012. And this chapter is part of the Hemophilia Foundation of Pakistan. Over time, this society has gradually moved into a hemophilia treatment center, providing treatment and care for the broad spectrum of patients with bleeding disorders across the Sindh province. Currently, this society has 10 employees and 2 doctors are working there in the society. Next, please. These are the currently registered patients in the society, which are 727. The majority are hemophilia A. There are 532 patients, followed by 113 patients of factor IX deficiency, followed by rare factor deficiencies. Because in Pakistan, the consensus marriages are very common, so you can see that we have rare bleeding disorders as well, which are registered in our society. Next, please. So coming to the challenges of hemophilia care and treatment in Pakistan, as I said, we don't have any government support to treat these bleeding disorder patients or to blood disorder patients, especially when these hemophilia patients get inhibitors. Similarly, the diagnosis is not freely available across the country. It's only available among the tertiary care hospitals and in their private setups. We don't have any hospital providing a free diagnosis among the government hospitals. Similarly, we have lack of training and medical support from the medical community for these bleeding disorder patients. Among the patients, there is lack of awareness. The patient, we have to aware the patient, give them education so they can understand their complications, their disease, and how this disease is transmitted so they can prevent this disease to the next generation and to bring improvement in the quality of care of these patients. These are the big challenges of hemophilia community in Pakistan. Next. Next, please. So with this dilemma, due to the absence of proper treatment and facility in the Sindh province of Pakistan, bleeding disorder patients get complications. All type of complications can be seen in these patients, especially their joints get crippled, damaged, and they become burden to the society over the time. Next, please. With this background, the Hemophilia Society of the Karachi in 2020 launched an advocacy initiative with the government of Sindh. The target audience were the government officials at the provincial level. The provincial health minister, Dr. Azra, and the director of the Sindh Blood Transfusion Authority, Dr. Durenaz, was targeted. The objective of this initiative is to make our voices heard and advocate to improve the quality of life of all the bleeding disorder patients, so we can make them an active participants and give them a successful contributors towards the society. With this background, we had two successful meetings, first on the 13th August and second meeting on the 14th September of this year, 2020. The outcome of this meeting was that the government committee assigned to work on a comprehensive plan with the help of NMO, the doctors, and the society. This initiative is part of the Hemophilia Welfare Pakistan strategic plan focused on advocacy for the government support at provincial and the federal level. And this plan was developed during the Brian visit in November 2019. We had a very successful Hemophilia Foundation Pakistan strategic planning meeting with Brian. Next. These are some of the pictures of our successful meeting with the Provincial Health Minister and the Sindh Blood Transfusion Authority. You can see that we had the meetings and we conveyed our feelings and our successful stories with them. So ultimately, they decided to work on our plan, and I will share with you the next, please. So we started to work on the project, which we did in started in 2018 with the World Federation of Hemophilia, the low dose prophylaxis program in Pakistan. And in that program, we enrolled 15 severe hemophilia A patients from the society. We presented the results of this study to the higher authorities who appreciated the progress and were making and ultimately asked us to prepare a project for the patients. Hence, the Karachi team prepared a successful project with the help of the World Federation of Hemophilia, and my special thanks is the Rana Sefi and the Asad Haffar, who step by step guided us, and we prepared a project and presented to the provincial government. Thank you. Next, please. The aim of our project was to start a low-dose prophylaxis program in our 74 hemophilia A and B patients of age less than 5 years. The primary objective of our project was to identify the effectiveness of low-dose prophylaxis regimen in severe hemophilia A and B patients, to find out the annual bleeding rate in these patients on low-dose prophylaxis. The secondary objective of these project was to evaluate the quality of life of these patients on LDP. to evaluate the joint health score and the functional independence score in hemophilia patients on LDP. Next, please. So this is just a brief overview of the budget summary. You can see that in hemophilia A, 60 patients who are less than 5 years of age, we decided the low dose prophylaxis dose based on the last WFH guidelines, which has just been published. The dose of 250 IU per week, twice a week for these patients, and the cost of this annual cost was this one. We added a 10% CFC cost in it for some accidental purpose or for the inhibitors. Next, please. Similarly, for the hemophilia B patients, currently the less than 5 years of hemophilia B patients are 14, and similarly this dose was calculated based on that guideline 250 international units of factor concentrates. These are the conventional factor concentrates available in Pakistan. Next, please. This is the diagnostic cost of hemophilia A and B patients. In this, we plan to all these patients are already diagnosed with factor level less than 1% of hemophilia A and B, but gradually we will do the inhibitor screening, as well as all the baseline workup will be repeated. We have a timeline maintained of these bleeding disorder patients, and we will do all the diagnostic costs. We have included the diagnostic costs of these patients in that budget summary, so we can identify the inhibitors in these patients and the low dose prophylaxis. Especially currently, the literature shows in Pakistan the frequency of inhibitors is around 10 to 14% in hemophilia A, and none of the literature published from Pakistan shows inhibitors of hemophilia B patients. Next, please. So limitations in Pakistan are that the consanguineous marriages are very common. Therefore, we have a high number of rare bleeding disorders in our country. But due to the lack of diagnostic services, we are unable to identify them. Similarly, due to the unscreened blood products, very high number of chronically transfused patients are infected with hepatitis B and C and HIV as well. So we can see from the literature, the most important is HCV is very prevalent in Pakistan, followed by hepatitis B and then HIV. Hence, these patients should be screened, treated and vaccinated accordingly. All hemophilia treatment centers should be connected to the regional blood centers so that the patients receive properly screened blood products. The plasma present in our RBCs should be used for fractionization to make the clotting factor concentrate, as done in other countries such as Iran. This will save the cost of our factors because we have to import them, which are quite expensive in Pakistan, and in this way we can prevent the wastage of our plasma as well. Next, please. So in conclusion, I would say that through the LDP project for children with hemophilia, we hope to lead by example for other chapters and provincial governments in Pakistan for advocacy, procurement and comprehensive care to improve the quality of life of bleeding disorder patients. Similarly, the COVID-19 has slowed us down, but did not stop us from continuing with our advocacy strategy in Pakistan. Next, please. So the key goal of the society is to adopt the challenges and realities of life with bleeding disorders in the province of Pakistan. If proper diagnosis and treatment is given, then a lot of things should be under control, which may enhance the quality of life of a person with hemophilia. Next, please. So in the end, I would say that if we all get united, we will stand, and if we get divided, we will all fall. Thank you.
Thank you so much, Dr. Munira. That was really wonderful. I loved hearing
Thank you.
how the impact of low dose prophylaxis and your data just clearly showed that impact. So that's an example of something that you could continue to share with your government and show that direct impact for patients' lives. So thank you very much.
Thank you.
Our next speaker is James Kago from Kenya. He is 34 years old, severe hemophilia A patient. James works as a human resources manager. He was born in central Kenya, Africa, and was diagnosed at a very early age. James believes that his life has improved greatly through factor donations from the WFH. James, welcome. And if you are on mute, James, please unmute.
All right, I'm actually unmuted. Thank you, Dawn. Thank you very much for this opportunity. My name is James from Kenya, and I'll be presenting the Kenyan advocacy success story. And before I do that, I want to congratulate the incoming new team led by the President, Caesar. Mr. Caesar, welcome on board. I want to begin, and basically I just want to limit myself to the advocacy and the successes of doing a proper and effective advocacy in the respective countries. So, but I'll share the Kenyan story. So we can go to the next slide. So I just want to introduce Kenya Hemophilia Association. It's an organization that is relatively very old, that was registered in 1978. We were actually recognized by the WFH as the patient organization in Kenya. In 2014, we had lost our registration certificate, so we embarked on registering the organization with the Kenyan government, which we did, and we now got a new certificate. And we held our first AGM in 2014 when Dr. Kibet joined the board, and he became the chair, and I support him as the treasurer, and Dr. Njuguna supports him as the secretary. We have an able team which is divided into two. We call it the board of directors. These are comprised of non-clinical. We have some clinicians on board. We have some medics on board, some parents, some patients, and some lay people. Then we have the executive committee, which is comprised of patients, parents, and clinicians as well. Both of these teams encompass the three kind of people, that is the clinicians, patients, and parents. So we can go to the next slide. So the moment the team came on board in 2014, we knew we could not achieve much without having a clear plan of what we actually wanted to achieve. So we sat down and we agreed that we needed to develop a 5-year strategic plan. And that was going to guide our key activities for the next 5 years. So we asked for opinions from members of the hemophilia fraternity, and we came up with 5, or basically 6, what we call the 6 key pillars that we were going to focus on in the next coming, that was from 2014 to 2019. So one of the things that we actually focused on was infrastructure development. This was basically to set up clinics, to decentralize service and treatment to the various members of public. And the second activity that we were going to focus on was improving the diagnostic capability by providing the diagnostic machinery and machines to hospitals that we have already established hemophilia clinics, as well as training the lab techs on how to carry out diagnostic testing. Then number 3, we are going to focus on building the capacity of healthcare providers through training and exposures to international best practices in management of hemophilia. Number 4, we focused on creating awareness to the general public, the patients, the parents, and then we realized also that even clinicians who are not entirely managing hemophilia had no clue or had no idea of what hemophilia was all about, other than just a small information that they had received during their training in class. So we embarked on creating awareness on what hemophilia was all about. Then we realized for us to effectively manage hemophilia in this country, we needed to engage the government. So we focused on advocacy, and I'll dwell slightly more on what advocacy initiatives that we undertook and how successful those initiatives were and what have been our key successes. Then lastly, we realized that as KHA, for us to continue into the future, whether with the current team or with the team that will come on board, we needed resources that were going to advance our cause and activities. So we have set up what we call a resource mobilization or sustainability initiative to ensure that we raise funds to support those activities. Next slide. So we embarked on an intensive advocacy campaign to lobby the government to be part of us. And we first focused on reaching the Ministry of Health, because they are our key stakeholder when it comes to treatment and management of hemophilia. Now, our advocacy has yielded a lot of successes, and I will just highlight a few of those successes so that we are able to understand how, if you undertake an effective advocacy, what are the likely scenarios that you'll have in your various countries. So in the last, I would say 6 years, since 2014 to present, we have been able to identify over 700 patients, hemophilia patients, and against a population of 5,000 potential patients. In Kenya, we have a population of 15 million Kenyans. That means that in every 10, we expect to have one patient, and therefore we anticipate that we're supposed to have 5,000 patients living in this country. But when we began in 2014, we had roughly around 34 patients that had been identified and are currently receiving treatment. This only means that we have a lot of work to do. We have only reached around barely 14% of the total hemophilia population. Then in the last 6 years, we have also been able to establish 2 comprehensive care centers and 4 hemophilia clinics across the country. These 2 hemophilia comprehensive care centers act as our referral in terms of management of hemophilia. The rest, the 4, actually serve us on a daily basis to manage the hemophilia patients that have already been diagnosed and identified to be hemophilia patients. Then we have trained over 400 healthcare providers on hemophilia identification and management. These include nurses, doctors, physiotherapists, lab techs, and other healthcare providers. We have also trained over 50 patients and parents on advocacy. This was critical for us because we needed to have a consistent message that we were going to convey to the government every time we had a fora to raise our activities. Then we have held over 10 successful meetings with policymakers, both at the MOH, Parliament, and other government agencies. We can move to the next slide. We have also been able to successfully submit a petition to Parliament. This petition were pushing, there were key activities that we wanted the government to focus on. One of them was to purchase factor for hemophilia patients in Kenya, recognize hemophilia as a disability or a disabling condition, participate in our activities, support us in whenever we had awareness or awareness creation initiatives. And this petition has already been debated in Parliament, and it was pushed to the Health Committee for deliberation. And then they were supposed to give back the recommendation, which has already been submitted in Parliament, and we are awaiting adoption. We have also been able to hold meetings with the MOH, and we actually worked on the budget for purchase of factor that we now submitted together with the petition, with the final document that was we were tasked to do by Parliament, that was submitted now to Parliament, and we are waiting for its adoption. Again, following the petition, the Ministry of Health was tasked to recognize factor concentrate as or include it into the essential drugs list. Previously, what was recognized was just the use of blood, whole blood, as a treatment or medication for hemophilia. Then we have been able to hold meetings with the National Council of Persons with Disability, which is an arm of the Ministry of Labor, and it recognizes the rights of people living with disability. And they have actually been very supportive. And we did an exercise with them to register people living with disability or people living with disability as a result of hemophilia. And this is already ongoing. We had a discussion with the Deputy President 2 months ago, and he actually took it upon himself that he will prioritize hemophilia treatment and management in this current government and in the future government. We can go to the next slide. We have also been able to, as part of the advocacy, we were able to liaise with Dr. Assad, and he was very supportive in the formulation of an MOU between the Kenyan government and the WFH, and which the government of Kenya committed to receive the donations and waive taxes on those donated factors. The government, through the MOH and county governments, has also been able to provide for us space to set up our hemophilia clinics. We have also seen the government's commitment in providing resources, both personnel and financial resources, to manage hemophilia condition, as well as in the running of hemophilia clinics. Then we have also seen a number of patients, myself included, having been recognized as persons living with disability. The benefits for this means that as a person living with disability, I'm exempt from paying taxes so that I'm able to cater for my medication. Number two, whenever you go to hospital, your disability card actually stands in the gap for you because you're not able to acquire national insurance. So you're able to be waived hospital expenses, some hospital expenses, because of being a disabled person. Then the government has also been participating in KHA activity. And these activities follow, we have had activities like opening of the hemophilia clinics. When we're handing them over to the government, we invite the county governments to participate, and the governors and their first ladies have been participating in some of those activities. And we're very proud because every time they come, they commit resources and personnel to those clinics. Thank you. We can go to the next slide. However, despite the many achievements that we have done with advocacy, 2020 posed a great challenge for us because of the COVID-19, and we experienced some challenges as we went along. One of the biggest challenges that we experienced was the disruption of medical supplies, especially factor concentrates. There was a delay both from the shipping end to the receiving in Kenya, because most of even the ministry officials in Kenya were not working. So we had quite some significant disruptions when it came to factors being donated in this country, and even the distribution of those factors when they arrived in Kenya. Then the other biggest challenge we had was the movement restriction of persons within the country. What this meant was that living in a country where majority of Kenyans live on less than $1 a day, it means most of the families were not able to fend for themselves, and we had quite a number of families going through a lot of hardship, and they were not even able to get food onto their table. So what we did as KHA, we were able to lobby not only the government but also individual and corporates, and we got some very good well-wishers who came in and supported us. And what has happened is that we have been able to support over 73 families with a monthly food subsidy of around $50. This was able to cater for their basic needs. That is, like flour, cooking oil, and even sanitary products. Then the other challenge that we experienced was with this COVID-19 pandemic, most families or everybody is supposed actually to have as well as sanitize their hands. However, one of the challenges that we realized was majority of the families could actually not afford. We could not afford. So what happened is that we had to actually go ahead and mobilize for partnership and collaboration with other stakeholders to come in and be able to provide the face masks that now the families are currently using. We got over 10,000 reusable masks that we have been distributing to the families, and currently I can admit that we have been able to reach, and they have actually helped in managing the COVID crisis that would have otherwise happened in this country. We can move to the next slide. So some of the key learnings, and one of the things that probably for me I would recommend to other hemophilia organizations as they think about how to do the advocacy in their own respective countries, I would want to say that for you to be successful in advocacy, you must have a clear message, but also, other than having a clear message, you must have a dedicated team. That's for us why we embarked on training a team of over 50 people, that is patients and parents, on how to go ahead and communicate to the government. The reason why we came up with this team was because when you go to the government, clinicians can actually elaborate on the medical side of the condition. However, they may not be able to relate with the condition if they do not see the patients. They may not be able to relate on the pain that parents go through if they don't see a parent who actually talks about that pain. So I would suggest that as you go into carrying out advocacy with your government, and maybe probably if in your countries you have county government, consider having a dedicated team that is well trained. The desire is that we have everybody who can be able to articulate the issues of hemophilia very well with the policy makers. But until you get to that level, have a dedicated team that can be able to do that. What we have also seen as our opportunities basically was also to collaborate with other organizations that have similar challenges like you, so that you have a bigger voice when you're going to the government. So what we did is that we have collaborated with other NCBs so that we can have a stronger voice. In the country at the moment, we have collaborated with the Sickle Cell Federation of Kenya. This basically is an organization for all sickle cell patients and parents. And when we go to the government, the doctors are the same. So we're able to articulate our issues in a bigger picture than we would just as hemophilia patients. One of the challenges that we've experienced in carrying out advocacy basically is the issue of resources. You'll always find that money is always a problem. Funds are always scarce. So how do you go about this? You have to prioritize. What is the message that you want to pass? What exactly do you want? Is it factor? Is it factor that you actually want to push for at this point? Or is it treatment facilities? Or is it diagnostic capability? So you must have a clear message of what is it that you want to push the government to do for you. Then lastly, on these key learnings is that you have to read the mood. You have to look at your current state of the government and ask yourself, what is the government prioritizing on? If we go with a message for hemophilia, will they hear us at this particular point? Currently, for example, the governments are grappling with the COVID-19. So even if you have a chance to meet with the cabinet secretary for health or the minister for health, the first question, if you mention health, he'll be asking you is, have you heard of COVID-19? All our funds are going to that. However, you can have a message of how is COVID affecting hemophilia patients, so that it's all linked together. So you must read the mood of the government of the day at that point, and then push your priorities accordingly. You can go to the next slide. So, as part of my recommendations to the organizations that are beginning at this time, I would say that the one way to win the support of the government for you to be able to adequately advocate is to start involving the government in your activities, such as the World Hemophilia Day celebrations. Ask them to participate. You can start with the lowest cadre of employees in the Ministry of Health if you are not able to get to the health minister. When they feel the impact of what your message is all about, they will even get the message to get to their heads of departments. Social media. Somebody talked about the use of social media. Sometimes you find today messages are, we become one global village. Just by use of our social media, somebody can post something in Canada and in 2 minutes we have it in Kenya. So try and use the various social media platforms that are available, and you may be surprised to see that your message has actually gotten to the highest office in the country. Then utilize corporates that are willing to partner with you. There are many corporates that are willing to partner in, especially looking through their corporate social responsibilities to create impact in the society. Some of them are willing to partner with you. Use their forums. Use those opportunities so that you're able to reach a bigger audience than you would on your own as an organization. Then lastly, consider forming partnerships with like-minded organizations such as NCD alliances so that your voice can be bigger. The louder the voice, the better for you as an organization. We have partnered with the Sickle Cell Federation of Kenya, like I said in the past, and the intent is basically to drum our support for blood disorders in this country, and the government must and will be able to listen because the voice is louder than they can actually withstand. Let's go to the next. So these are some of the pictorials or some pictures of some of the events that we've held. On the extreme left is myself, Dr. Kibet, and Carlos, when we went to Parliament to present our petition to the Honorable Minister, Honorable Member of Parliament, David Ole Sankok. He's a member representing persons with disability, so he's actually the one who actually pushed the petition in Parliament. The next photo shows Irene Chami giving a talk during the opening of our clinic in Voi at the coast region early this year before COVID impacted on us. On the upper right, we have the team when we were meeting with the Sickle Cell Federation, and this team basically became like the interim officials to come up with activities that we'll do jointly so that we're able to drum up support for this country, for this condition in this country. Then lastly, below there, we have Her Excellency, the First Lady of one of our counties called Kisii. She's called Elizabeth Ongwae, during the opening of one of our clinics on the western side of Kenya. Accompanied her, she was accompanied by two other First Ladies, that's a First Lady for Laikipia and First Lady for Bungoma. Then we have Dr. Kibet, of course, looking on at that picture. So we can go to the next. So thank you very much, Santini. I'll wait for the questions.
Thank you so much, James. I appreciate it. So I would just like to request, if you are able to please stay on the webinar. We will keep this open and we'll try to answer as many questions as possible in the next 10 to 15 minutes. So with that, I just want to thank our panelists. Thank you all for sharing your different stories. They all give different examples of how you've advocated for treatment and care in your countries and also during COVID. So the first question, I'm just going to get right into it. We had a question about how do you get across to a difficult audience such as your government who are really interested in having a gain in every public decision that they make? How do you get them to prioritize or focus on bleeding disorders? And so maybe Dr. Munira, I will start with you. How did you get them to understand that treatment and care for hemophilia really was something that they could take on? And you are muted, so unmute yourself, please.
Can you hear me?
Yes, thank you.
Okay. As I said in my presentation, this activity was started last year in November 2019. And we as a society of all the patients and doctors and the volunteers started to feel that we have to work as a team to hear our voices. So we we took all the stories and pictures and the social medias, and we started to knock to other government officials. We, as you said, that we started to see them through their office people. We started to see them through them, because it's not easy for us to directly meet the officials.
Yes.
They gave us the way how can we meet them. So we had like on the World Hemophilia Day, we make stories, we publish articles, we present them stories, we give them pictures, and we presented all our data of the society, what the Karachi chapter is doing in the Sindh province. And ultimately, by convincing all the office bearers of the ministers, we were able to see them in, I think, around 1 year almost.
Wow. Wow, that's excellent. And thank you so much. It's such a perfect example of what we were talking about earlier. So thank you very much.
Yes.
Julie, I think you are still on. I've got a lot of screens here. Julie, the next question is for you. And it came from Alex Stewart. And he said, why so few hashtags for Facebook and Instagram?
So the few hashtags was for Twitter. So on Twitter, you should use 2 to 3 hashtags maximum. And there have been lots of tests by lots and lots of groups on what is the formula for success. So 2 to 3 hashtags for Twitter. For Instagram, it's the opposite, 15 hashtags plus. And Facebook, you actually don't even need hashtags for Facebook.
Right.
So 2 to 3 for Twitter.
Excellent. Thank you so much. That's really helpful. And then another question came in, you know, for an NMO that does not have any paid staff, which is many of our NMOs, how do you dedicate versus those NMOs that have paid staff? I think sometimes when we are an NMO and we see those who have 1, 2, or even more paid staff, you say, oh, well, that's how they're able to do this. So the question for our panel is, how, if you have only volunteers, how do you make those steps? And I'll start, since I'm the moderator, I get the privilege of keeping to answering it. But I will say that we've worked with many NMOs that don't have paid staff. And the first thing you do is you have an education to your members, to the people, the families that are affected, and you find volunteers that are passionate about advocating, and you create a committee. And that's the first step, because you, like I said earlier, you just can't do this alone. And then that committee can help take steps and steps. The other thing is your regional managers from WFH are extremely helpful in those trainings and in being able to host Zoom calls with your families. So that's the first thing that I would recommend, that make sure all your volunteers work together as one. But I would also like to open this to the panel about how you have been able to do this. And maybe James, I may ask you in Kenya, what were you able to do? How did you get your, I saw that you've trained healthcare professionals, you've trained 50 patients and parents on advocacy. How were you able to do that without using paid staff?
Unmute. Sorry. So what we've been able to do, basically for us to be able to reach those number of patients and parents, we did what we call the summer camps. I think you call them summer camps, but in Kenya, we normally organize them around August during the school holidays, because we target patients who are above 18 years. Issues, and we hope most of them are actually in colleges or in universities. So we try to book our activities when the universities are closed. That is around August or April or December. So mostly we hold our youth camps in August. So we take them to a forum. What normally we do is that some of our board members are actually experts in various fields, and they can actually volunteer to do the trainings pro bono. So basically on a pro bono basis, and you have your patients and parents and even clinicians can actually communicate with them what you actually want to achieve at the end.
Excellent, thank you. And you broke up a little bit, but what I think I heard you say is that you were able to get experts to be able to present pro bono, so for free, we were able to get them to help with the trainings and to use what we would call summer camps, but you call it something different. That's how you were able to access the parents and the families to be able to find the interest. And then, so moving on to the next question, this one is for Alex. The device that you used, this phone app, was that able to give information about a dose in case of emergency situation? And Alex, you are on mute if you could hear me.
Yeah. Sorry.
No, it's okay. I can hear you.
It's possible to attend for emergency situations, and now the project includes several details, and we are willing to partner with everyone. Maybe it's to answer this interesting question, but we will answer it later by email, I prefer, because it's possible to make adaptation for all the realities, because are many in Brazil too, are many inequality situations in different regions. So we can make adaptations for all. But the interesting thing is attend with information the emergency situations with the application.
Excellent, thank you very much. So we had a question, and actually I think it's a plea for help, but I wanted to bring attention to it, and it's from Seba Mohammed. They said, hello from the Palestine-Gaza Strip. We are suffering a lot from a serious shortage of treatment. It is very bad complication for our youth and children. We have no specialized healthcare providers, and disability is the future of our children. We need your help as WFH in any normal situation, but especially during COVID. So I think that my advice would be to reach out to your regional manager to specifically talk about some of the things that you can accomplish, and they can help guide you in what those first steps. Would anyone else like to comment and give advice for Seba?
I could comment maybe, Dawn.
Yes, thank you.
And thank you very much, Seba, for pointing this out. We are aware, of course, of the situation in Palestine and the difficult times you go through. And we are working, working closely to establish a dialogue with the government there. And we've launched this year a GAP program also in Palestine. And we will certainly work with the NMO closely through our regional manager, but also the humanitarian aid team to continue supporting patients in Palestine. But
thank you so much, Salome. That's really helpful to hear that. And then going back to Julie, one of the things that a question came through is just about how can you be careful when you're posting in social media? The example was used with Facebook, but how can you be careful with all of your social media? Because really, once you've posted it, it's there forever. So what are some guidelines to help us not make some serious mistakes? And this is for Julie. So if you're muted, please unmute. Is Julie still on, Salome? You're muted too, but I see you shaking your head.
Because she left a message that she had to disconnect in a couple of minutes, and I can see her. She had to disconnect already, I think, because we went over the time. So
yeah, no, we have absolutely. So the rule of thumb, I will tell you, that we use for social media at NHF in the US is that the key to getting anything accomplished is really to stay kind and professional, even though sometimes we want to be angry. And right now the United States is if you look at our social media, it's a little crazy right now with the election in 7 days, but we keep to that. Stay factual, stay kind, tell positive stories, and ultimately it is there forever. So if you follow guidelines and write them down, we have key rules that we follow. So write those rules down so that anytime you post to Facebook or any social media, you look at the rules and you say, is this something my mother would be okay with seeing? That's the first one we always say. Would mom be okay with me posting this? Is this going to upset anyone? Does this tell our story? And did we use the right image? So we have these key guidelines that we always look at before we hit post. So hopefully that will help you. A question about undocumented migrants. What do countries do with undocumented migrants and therefore the healthcare system cannot treat them? Would anyone be able to comment on that from our panel?
I could comment maybe.
Okay.
Thank you, Dan. This is a very difficult question, certainly, and I know that from WFH we are able to support some migrants and refugees that live in other countries that have been displaced in selected countries, and we have actually collaboration with some of our NMOs, some of you. Through whom we're able to help some of the patients, but I think this problem certainly is wider than we're able to meet all the needs. And starting from the fact that the migrants are undocumented, so there are cases when we simply don't know where these patients are. So thank you for bringing up. It's a very important but difficult issue. Yeah.
Yeah, and we face that in the United States as well. I will tell you that our hemophilia treatment center doctors still will see undocumented migrants because we just feel that it shouldn't matter where you live in the world, that they should get access to treatment, even though they will not be reimbursed or paid for those services. They just treat patients, you know, because our doctors are amazing. So I saw a question, I thought I'd bring this up just for everyone. It was Bradley regarding the application that they've developed in Brazil and thinking about NMOs that would like to reuse some of the functionality without having to develop it from scratch. And was the application the property of, or was it a third party? And so then I saw later that Alex responded, the application was developed by the Brazilian Deferment of Hemophilia. And actually, I think it was, Federation of Hemophilia, and they are available to establish partnerships to help everyone. So he is saying you are welcome to contact him to talk about the ability to potentially create an application to be used in your country. So that was excellent. And then I think we have time for one last question. I know we're way over time. I could do this forever, but I'm sure not of all of you guys. So Salome, do you see one last question that we could address, or should we close it out? I see a lot of thank yous, so I'm reading.
I think, yeah, there were a lot of comments in the chat box also, but in the Q&A, I think we have covered the questions. Of course, there was a question in the beginning that whether we would be sharing the presentations, and yes. I think we've mentioned it in the beginning of your talk that we will be uploading also the recording in all languages. So we had in 5 languages today the webinar on the e-learning.
Well, I just want to thank our panelists. Every one of you told a little bit of a different approach to advocacy, which shows you that you can do it in many different ways. So thank you so much to our panelists, excellent presentations. It's been a joy to be with all of you today, and I wish you all well, and please stay healthy and safe and wear your masks. Thank you.
Thank you.
Thank you for all. Thank you very much.